Hello and welcome to IMA Talks, the podcast where we talk nerdy about massage and with massage therapists from all over the world. This is part 3 in the small podcast series done at the IMA World Championships in Massage 2024 in Copenhagen. Native English speakers, please be patient and gentle with me, with us, because there's so many good points and so many nice things are said. The person in the couch this time is used to perform in front of a microphone. Because besides being a therapist, he's also a singer, a musician, a composer, and a performer. So no wonder that he has such a nice voice. Enjoy. Okay, so we are rolling.
Very good.
I'm sitting here with Adam. Can you please help me with your second name again?
My name is Adam Baritot.
I'm very pleased that you're here. Can you describe yourself in such a more formal way?
I am a professor of massage therapy, and I teach for Pacific College of Health Sciences in New York and for Queensborough in the University of New York system.
Okay, yeah, that's... it already opens many questions. But another question, can you present yourself in a more informal way?
Absolutely. I've been a massage therapist for about 25 years. I love traveling Europe. I'm so happy to be in Copenhagen. I especially love the food when I travel. I'm a great fan of gâteau basque, which if I can get to France before I head home, that would be tremendous.
I need to know what that is.
Gâteau basque. It is a very specific cake found in the Basque region of France. So southwest of Bordeaux, you'll find gâteau basque. And my family comes from there, and it's just this beautiful, beautiful dessert that I wish to be eating right now.
Yeah, me too. Yeah, I will look it up. Also, we are still on the informal track because we would like to know a little bit more about who we are talking with. Can you tell me what do you like?
What do I like? Obviously I love massage, and that's why I'm here. I've mentioned loving travel. I like bowling. I love card playing. I love the touristing. I love walking around this beautiful country and just seeing all of the wonderful sights and sounds and enjoying the flavors of the world around me. It's one of the great things that drove me to massage, the ability to take it with me and see the world around me.
Yeah, but that leads to the next question. How did you end up in the world of massage?
What a very good question. I started out in my late teens going to college for opera. And I studied with a wonderful woman named Carol McCamus, and she is a Guild-certified Feldenkrais master. And she mentioned to me, hey, this bodywork thing looks like something that would interest you. I was fascinated with anatomy and physiology. And between her and my spouse, they both nudged me into studying massage. And it has been the larger and better part of my life that I've gotten to do that.
Mm-hmm. And how old were you at that time?
Oh, goodness. When I was first interested, about 20, 21.
You told me you are teaching.
Yes.
Do you also practice?
Absolutely.
Yeah.
I have a practice which is largely based in Manhattan.
Mm-hmm.
Most of my work is house calls.
Mm-hmm.
It's largely medical massage, although I do some sleep massage, some putting clients to sleep who need it, which is a fascinating side practice.
How does this take place?
What happens is an appointment is booked for a late hour, usually 9 p.m., 10 p.m. You go into a person's apartment or their home. Generally, they will own their own table. You really don't. This is a very New York thing. Our clients own their tables.
Yeah.
We'll set up their table. We will work on them. Usually, it takes about an hour using specific techniques to help your client fall asleep. Once they're asleep, you very quietly sneak out and let them fall asleep. Usually their doors lock behind you, and you have done your job.
Oh, that sounds wonderful.
It's really amazing.
I mean, of course, I know also as a massage therapist that your clients very often fall asleep because they are relaxed, but I have never heard that is a practice where you agree on leaving afterwards. That's
Absolutely.
very special.
You are paid ahead of time.
Yeah.
You slip in, you go in, they're very welcoming to you. You go in, you do your work, and ideally they are totally asleep by the time you leave. If they're not, sometimes you'll help them transfer to a bed so they can sleep. But your goal is to down-regulate their nervous system so that they are better able, they're in an alpha wave or a theta wave position in their nervous system, so they're better able to sleep.
Now we have heard a tiny bit about your practice. What would you consider your strength?
Oh, goodness. My strength is in medical treatment massage or clinical massage. I focus my practice largely on techniques like myofascial release.
Oh, yeah.
I use trigger point therapy with great efficiency. I love positioning the body so that gravity helps the body fall back into its normal place. And that's a little bit of NMT, a little bit of neuromuscular therapy to allow for that to happen. It made sense to me coming out of being an opera student all those years ago that if the body obeys gravity, if your body moves well in gravity, things will fall into place better on their own.
Yeah, that's very true. What experiences did you have here of the Massage Championship?
I've had the great delight to be present for most of the sports massage competition. I've enjoyed sitting in the auditorium near here. It has been truly fascinating to me, the breadth of style and the quality, such brilliant quality coming from all over the world. I can honestly say that I would want to have a massage from just about everybody I saw.
That's a good sign.
Oh, it's a really good sign to see that. So many good massages. I can't even summon any names because I just look across the room going, yes, please, I want that massage. As a teacher, my teacher brain is going, that's an A, that's an A, that's an A, that's an A, that's outstanding. And I feel like that this is indeed where the world's best are. We are watching the world's best massage here performed in front of us. And what a treat. What a treat if you're a massage therapist to see great massage in front of you.
Yeah, I mean, I think that is very interesting because it's very seldom that we talk about how much we enjoy massages ourselves. I'm a great user of massage. That is basically almost the best way of being being taught. Sometimes to receive a massage yourself. I think I will talk more with the people here in the couch later about how they feel about getting massage themselves. I always sit and think, I will, like you, I would really like to get a massage by this person. Yeah. I heard a program the other day, and I don't know if I should smile or laugh or cry, but there's a lot about talking about AI, and one question was to this expert that was there: is it then all the brainy stuff that will disappear as a job? Is that the first thing that will go? And he said no. He thinks that it's all the body work, the physical work, because he believes that robots will take over the world and such things. What is your opinion about? Because then I immediately think, oh my God, there will come massage robots and they will. You're laughing.
I am laughing a bit.
Yeah.
I would not worry about it in our lifetime. No. I think that there are things that the robot cannot yet do. There are qualities of touch. There are intuitions that we get as massage therapists. The idea that you're working along, you're like, oh, I'm seeing this reaction. Maybe I need to approach this from a different direction. We're not seeing that with robots yet. The school where I teach has a massage chair, a robot massage chair, and it has pre-programmable sequences where you can sit there and receive a track massage or a police officer massage or whatever job associated to it.
Oh, yeah.
And I got in there and I'm like, okay, let's try this teacher massage. And I did not care for it, not even the slightest. So not yet do we need to worry about robots taking over what we do. There's always this human element, this intuition element where we can perceive, not necessarily judge, but perceive the differences in the bodies and get a sense of weighing it against the things we've done in our own lives, that whole evidence-informed practice idea of, I recall a set of shoulders like this 15 years ago. I did this and it worked. That kind of experience. While AI is learning, while AI is learning, I don't think we're there yet. I'm not worried about my job, but it is fascinating, and I will continue to be interested in what goes on there in the future.
Yeah, definitely. Yeah, good words. I think we end here on this. Thanks a lot for this talk.
Thank you so much. It was my pleasure to talk to you.
I read on a website about Adam's massage, about his special focus on clients who use their bodies for a living. Athletes, singers, dancers, and other high-performance body types. Gâteau Basque is a traditional dessert from the Basque region of France. It's typical filled with black cherry jam or pastry cream. I would really like to speak to Adam again about his studies in the Feldenkrais method, short FM, and get to know more about this type of movement therapy. I hope that you enjoyed this podcast. Thanks to IMA for making all this possible. My name is Søren Dø, and remember, the future is in our hands.